Welcome back. Today we're doing a deep dive into a pretty bold claim from a telemedicine service called STRIDE.
Right, they're talking about an 89% cure rate for toenail fungus. I mean, onychomycosis, technically.
Yeah, and that 89%, it definitely jumps out, doesn't it?
Yep.
Especially when you think about how common this is.
It really is. We're talking over 12 million people in the U.S. alone. And, well, the usual treatments, they're not great.
Not at all. Over-the-counter stuff, you're lucky to hit, what, 20%?
If that, and even the standard prescriptions, things like Lamisil taken orally, they tend to hover around 50, maybe 60% success.
So that's the big question, isn't it?
Yeah.
If STRIDE is using the same FDA-approved medications, how on earth are they getting close to 90%?
Exactly. Where's
Yeah.
the magic? We looked into their research, their whole business setup, really tried to unpack it.
Okay, so what does the process look like for a patient?
It's pretty straightforward telemedicine, actually. You go online, upload some photos of the nail, fill out a health questionnaire.
Standard stuff.
Yeah, then licensed clinicians review it and prescribe a 6-month supply of medication, usually tolbenafine or maybe fluconazole, so FDA-approved drugs.
Okay, so the medication itself isn't some secret formula. But they do seem to focus on credibility, right? I saw they partnered with Dr. Neil Sadik.
That's a big one. He's a well-known dermatologist, published hundreds of articles, gives them, a solid clinical backing.
And there's a topical component too, isn't there? Clear nail renewal.
Yes, and that's actually quite important. It's not just the oral medication. This topical uses things like ascorbyl glucoside and lactic acid.
Which helps.
Basically, they help soften and prepare that thick nail plate. Makes it easier for the medication, even the oral kind working from the inside out, to penetrate the nail bed where the fungus actually lives. It enhances delivery.
Interesting. So better penetration helps. But that still doesn't fully explain the jump from 60% to 89%, does it?
No, the real innovation, the core difference, seems to be how they dose the medication.
Right.
Traditionally, with terbinafine, you take it every single day for 12 weeks straight.
All right. And that comes with risks.
Definitely. Continuous daily dosing puts a strain on the liver. That's a known side effect risk. And honestly, compliance is a huge issue.
People stop taking it too soon.
All the time. They see a little improvement, the symptoms maybe ease up, so they think they're cured and stop the pills. But the fungus is still lurking deep down.
Ah, okay. So how does STRIDE change that?
They use something called pulse therapy. It's based on published clinical approaches.
Pulse therapy.
Yeah. Instead of daily pills for months, you take the medication for 7 days straight. Then you stop for 7 days, then 7 days on, 7 days off. You repeat that cycle.
7 on, 7 off.
Mm-hmm.
Huh. Why does that work better? It seems counterintuitive, like you're giving the fungus a break.
You'd think so, but the studies actually show it can be just as effective, sometimes even more effective than continuous dosing.
Really? How?
Well, 2 main reasons. First, it dramatically cuts the total amount of medication your body processes over the treatment period. Less drug exposure means significantly lower risk of those liver complications.
Okay. That makes sense for safety and maybe keeping people on the treatment.
Exactly. Better adherence. But also, the drug apparently stays active in the nail tissue for quite a while, even during that 7-day off period. So it's still fighting the fungus under the nail while your system gets a break.
So the pulse lets the body clear the drug systemically, reducing side effects.
Yeah.
But the drug persists where it's needed in the nail.
That seems to be the mechanism, yeah. It leverages the drug's pharmacokinetics.
Clever. But it still takes time, right? Fungus treatment isn't fast.
Oh, absolutely not. You have to be patient. Full clearance, seeing that healthy nail grow out completely, usually takes 8 to 12 months. That's just biology. Toenails grow incredibly slowly.
And their money-back guarantee probably requires sticking it out for that whole time.
You bet. You need to complete the full prescribed course, which makes sense medically.
Now, we should mention, it wasn't all perfect. We saw some caveats in user feedback, didn't we?
We did. 2 main things came up. Some people reported having trouble reaching customer support, which can be frustrating.
Yeah, always a pain.
And second, a smaller number mentioned their conditions seemed to get worse, not better.
Okay, that sounds more serious. Is that a failure of the pulse therapy?
Not necessarily. It actually highlights why that initial clinical consultation, even via telemedicine, is so crucial. There are different strains of fungus. If you happen to get the wrong type of antifungal for your specific strain, it just won't work, and the fungus might continue to thrive.
So that points to the importance of accurate diagnosis and prescription, even with a good system.
Precisely. It's not a one-size-fits-all cure, even with the high success rate. That initial assessment matters.
All right, so wrapping this up, what's the verdict on STRIDE after this deep dive?
Well, based on the evidence, it looks like legitimate telemedicine being done quite thoughtfully. They're using established, proven medications.
But applying them differently.
Exactly. That pulse therapy approach is based on published research, and it cleverly tackles the biggest hurdles of traditional treatment, the side effect risks, and the patient dropout rates. Improving those naturally boosts the overall success.
So the 89% claim, well, maybe optimistic marketing, seems rooted in a genuinely improved methodology.
It appears so. It's a smart application of existing tools and knowledge.
It really makes you think, though, this idea of pulse therapy, taking planned breaks from medication to cut side effects but keep the treatment working.
Hmm.
What could that mean for other conditions? Long-term chronic illnesses where people are on drugs continuously, often with significant side effects.
That's a really interesting question, isn't it? Could this kind of intermittent dosing strategy be applied more widely? It's definitely something worth mulling over.